Good day, everyone. I am Janaya Tokmo and I will discuss to you the patient's health history. However, before I formally start, I would like to emphasize that the health history of the presented patient is limited. What I am about to present are purely the patient's information which are virtually given within the 3 days of care. For the first part of our nursing health history, let me give you an overview. So health history or nursing health history is a holistic assessment of all factors that influence a patient's health status with subjective and objective data that can be obtained in taking health history. Subjective data includes demographic information, patient and family information about past and current medical condition, and patient's information about surgical procedures and social history. Meanwhile, objective data are informations that the healthcare professional gathers during a physical examination and consists of information that can be seen, felt, and smelled. To keep the patient's identity and thereby preserving her right to privacy and confidentiality, we will give the patient a pseudonym of Miss N. For the patient's demographic profile, Miss N is a 46-year-old female with a Filipino descent. For the history of present illness, Miss N, while on a vacation in another country, developed an abdominal pain in the left lower quadrant. Miss N presented in the emergency room with the chief complaints of episodic abdominal pain, low-grade fever, and diarrhea in which she experienced for almost 2 weeks. She delayed seeking health care because she was not familiar with the country's medical system and the assumption that what she felt, described by her as stomach bug, was caused by food or water she consumed. Ms. Ann's initial assessment yields a finding of dehydration with a fever of 39.2 degrees Celsius. Vital signs are blood pressure 106/58, pulse rate of 88, respiratory rate of 22, her potassium level is 2.8 milliequivalent per liter, erythrocyte sedimentation rate or ESR of 37 millimeter per hour, a white blood cell or WBC of 16,000 millimeter cube. An abdominal pelvic computed tomography or CT scan revealed diverticulitis with a question of an ileus. For Ms. N's course of treatment on March 5, 2021, Ms. N was given IVF D5.03% of normal saline 1 liter with 20 milliequivalent of potassium chloride at 50 ml per hour. She was ordered to be on NPO except the medications, and she was also ordered to have bed rest. Vital signs every 4 hours, stools to be checked for occult blood, and strict I&O every shift. Repeat blood work in the morning to monitor potassium. Her medications includes difenoxylate, atropine sulfate, 2.5 milligram or 0.25 milligram per tablet, 2 tabs every 6 hours. Propanthelin bromide, 15 milligram PO every 8 hours, AC and 30 milligram PO every before bedtime. Paracetamol 500 milligram every 4 hours as needed, Prorenatap or PRN. Metronidazole 500 over 100 ml bottle, IV every 6 hours, and tramadol of 50 milligram for slow IV every 6 hours. On March 6, 2021, at 10 a.m., the doctor ordered for her to be scheduled for sigmoidectomy and colostomy surgery the next morning. On 2:30 p.m., through telephone order, IVF was followed up with plain NSS 1 liter at 60 milliliters per hour with IV cannula gauge 18 due to surgery tomorrow. On March 11, 2021, as usual, patient was under strict I&O monitoring every 4 hours as well as vital signs. Medications were cefoxitin 1 gram IV every 8 hours, ciprofloxacin 400 milligram IV every 12 hours, dexketoprofen 50 milligram in 10 ml of PNSS, slow IV 20 minutes per 8 hours or every 8 hours. Tramadol 25 milligrams slow IV every 6 hours as rescue dose for pain. Omeprazole 40 milligram IV every 24 hours. A new doctor's order was given on the same day. IVF to follow, D5LR 1 liter at same rate, right cephalic vein, PNSS 1 liter at same rate, left cephalic vein. TPN to follow, Combiflex 14,000 kilocalorie to run for 36 hours. I would like to correct myself. It's not 14,000 yet, 1400s or 1,400 kilocalorie to run for 36 hours. It was also ordered or indicated that the patient must be encouraged to have deep breathing and must be referred to the physician as needed. And that would be all for the patient's health history.